Chapter 19, an overview of the analyses in our portfolio. The analyses that we offer, obviously we have lots of other genetic tests, but the ones that are really interesting are, in my opinion, the preventive medical genetic tests as well as the lifestyle genetic testing. And these are classed in two different brands, really. There's the brand of DNA Health Control, and this really is a genetic testing program that focuses on diseases, disease risks, on drug mechanism, which drugs work better, which ones should be avoided, on the optimal therapies and prevention programs. So this is all about diseases and health. These kind of things should be done with doctors that can guide you through the prevention program. And this is the DNA Health Control section. And then there's the DNA Nutri Control. This focuses on things like weight loss. How does my body respond to certain nutrients? Which nutrients should I avoid? Which ones can I eat more of? About healthy diet. So what food is good for me? What is bad for me? There are very strong differences, very big differences from one person to the next. And micronutrients. What kind of vitamins work for me? Which ones don't? Which ones are required in higher dosages? And which ones are not going to be effective? And also sports stuff like athletic performance. And this is the DNA Nutri Control area. And while these are really for doctors, they should use them for medical uses to help in prevention. The DNA Nutri Control section is for people that work with weight loss, diet, and so on. So dietitians use them, sports studios can use them to help lose weight. 80% of all people that go to a sports studio want to lose weight. So this is an area where these programs can be used very well. And athletic performance is really for professional athletes that want to improve their performance through the right nutrition. And this here is an overview of our current portfolio. It might already be different if this is a bit into the future. We keep developing new tests, but I want to talk you a little bit through the different portfolios and programs that we have that will help you understand the program. I want to start with the DNA Nutri Control program. Let's start with the weight sensor. The weight sensor is for overweight people that want to lose weight. It is a program that will send a person through more exercise, eating less. This is standard things about losing weight. However, we fine-tune the program based on genetics. So eating less is something they're going to have to do. However, we can tell them based on genetics, you can eat more fat, less carbohydrates, or less fat, more carbohydrates. So we can modify the diet. While you eat less, you also eat less of the stuff that is a problem for you and more of the stuff that is not. We can also adjust the sports program that you should do to lose weight and so on. So a person that is overweight should use the weight sensor, and the person will also get the food list. This contains more than 1,000 types of food that are rated in terms of their potential for gaining weight. So if I'm fat sensitive, which I'm carbohydrate insensitive but fat sensitive, then all food that contains a lot of fat is bad for me, and I get a red bar. And everything that contains more carbohydrates and less fat is good for me in terms of obesity, and then I get a big green bar. So this is the weight sensor, and it contains the food list. If a person is overweight and wants to lose weight, they have to do this. Do not think that this means a genetic test is done and then you can sit on the couch and you lose weight. It's still a weight loss program. You eat less, you eat healthier, you do more exercise, but you do the right type of these things, and this increases the effect. Okay, that's the weight sensor. Then there's a nutrition sensor. As I said, we've got this food list which tells you this food causes you to be overweight and this one doesn't. And both of them might be milk products. This does not tell me yet I'm lactose intolerant, that's why milk products are not a good and healthy idea for me. So the nutrition sensor tests more than 50 genes. It looks at all of the different disease risks and then modifies my nutrition so that I avoid food that is bad for me, like for lactose intolerance or iron containing foods. If I have iron overload disorder, if I have a high risk of osteoporosis, I get more food that contains calcium. And if I am lactose intolerant as well, then it's not milk products but other calcium sources and so on. So by looking at these 50 genes, we look at more than 20 metabolic problems that are genetically modified, and then we basically find out what kind of food is good for you and what is bad for you. This, as you can see, also contains a food list. So you can say, I only want to know what is healthy for me and what is not. Then you do the nutrition sensor and you get the food list, and you get smileys, like little faces. If you get lots of happy faces, it means very healthy for you. If you get lots of sad faces, it's very unhealthy for you, or anywhere in between. So this is the nutrition sensor. So a person that says, I want to know how to eat healthy, but I don't want to lose weight, should do the nutrition sensor. A person wants to know, how do I lose weight? Just the weight sensor. And a person who wants to know, how can I modify my whole nutrition to suit my genes, would do the whole package, the DNA Nutri Control package. So this is the main lifestyle program. Now, there are some other programs, the athletic sensor. It says athletic sensor here. We've renamed it to sports sensor. And this is a new product that is being launched in 2014. And this program basically looks at these aspects. However, it's modified for athletes. So an athlete who wants to have better performance has a number of factors that need to be considered. For one thing, if a person wants to run a marathon and is genetically lactose intolerant, really shouldn't drink a milkshake before running, because they're going to have digestive problems. So it's a very, very obvious way in which genetics can modify the athletic performance. But there are also other things. Detoxification of certain toxins is inhibited by certain genetic variations. So people should avoid certain foods and eat some other foods to help the body detoxify, to make sure they're free of toxins and have optimal health. Also, genetic variations can have an influence on the function of the joints and increase the risk of joint disease, and through a certain diet you can modify this. So the athletic sensor is for professional athletes that want to know, what can I eat, what balance of carbohydrates and fat should I eat to get the best performance, what micronutrients do I need in which doses, because professional athletes, they produce a lot of free radicals. They're kind of like toxic chemicals or substances that start destroying the tissues. And these free radicals need to be neutralized. And people that don't do athletic sport, they produce a certain amount, and we have a certain amount of vitamins that neutralize these. However, professional athletes, it's similar like in smokers or in alcoholics, they produce many more free radicals. So they need a higher dose of antioxidants to neutralize this, to protect the tissues. So again, you need to modify the nutrition to make sure that you get enough of these antioxidants. However, there's also the possibility to use supplements to combat this. And then there are some athletes that need to lose weight to go into a certain weight class for combat sports, for example. And this kind of includes the weight sensor into the program. So an athlete can use this whole program to eat right, and if necessary also to lose weight, to, for example, in combat sports, to fall into a certain weight class. And they have a problem when you want to lose weight and also train. You want to have a high performance, however you want to lose weight. And to have high performance, you need as much energy as possible, and to lose weight effectively, you should eat as little energy as possible. So it's really the opposite thing that you're trying to do at the same time. Now, what we did in this program is we kind of integrated the weight sensor system. We find out what balance of carbohydrates and fat you need for optimal performance. It's different for endurance sports than for sprint sports, for example. And then we reduce the overall amount of calories. So you're taking in fewer calories than you should eat, then you need to maintain your weight. However, the calories that you eat are still the best possible balance for high performance. And this is also integrated here. So if you are an athlete, no matter what kind, and you want to improve your performance through the right nutrition, the sports sensor is the right program. It doesn't make sense to order this together with any of these, because the nutrition and the weight sensor are both in a modified way included in this program. So athletes should do this, and people that don't do competitive sport should order one of these. NutriMe Complete is called NutriMe Nutrition. It is a personalized supplement, because from the nutrition sensor as well as the athletic sensor, we found out how many free radicals you produce and how many antioxidants you should eat to reduce that. And by this concept, we are dosing more than 20 different micronutrients based on your genetics. And this is what it looks like in the end. This is NutriMe Nutrition. This is personally created based on a genetic profile. There are around 700 trillion different recipe options, and only one of them applies to you. So this really is highly personalized. And it is made of lots of small pellets, small, we call them microtransporters, which each contains one vitamin. And by mixing them together at different combinations or different dosages, and by using a spoon, you get your own personalized mixture that makes sure that you get the right dosages for your genes. And this can be ordered in addition to the nutrition sensor or the athletic sensor. But we really do need the genetic results in order to be able to produce this system. It will be adapted with increasing age, and it gives your body all the nutrients that you need based on your genetics. So this is really a supplement that can be taken on a daily basis. Now on the other side here, the Nutri Control recipe book. This is based on the weight sensor. It is a book that will use your genetics. We find out you're carbohydrate sensitive and fat insensitive, for example. We know how much you're allowed to eat. So this recipe book is going to give you 40 different daily menus of what kind of things you could eat. You can pick and choose what appeals to you. And it will also give you around 100 different recipes, more elaborate recipes of lots of ingredients, where the ingredients are up or down regulated in amount to make sure that you lose weight or maintain weight using this. So this is the recipe book, which can only be purchased based on the weight sensor. So we need the genetic information from this to create this recipe book. And then there is NutriMe Weight Management. And this looks like this. It is a supplement. It's actually a medical product. Medical product means it is registered as a medical product. There's science that has shown that it works the way it claims to have worked. And it's based on the weight sensor. In the weight sensor, we find out you're carbohydrate insensitive and fat sensitive. Then there are two components that go into this product. One of them, you can imagine it like a sponge. One of them is a sponge that absorbs fat and prevents it from being absorbed into the body. So if you're fat sensitive, this is going to have a better effect. And the other one prevents your body breaking down long chain carbohydrates into smaller pieces. And if you don't break them down, they can't go into the bloodstream and they remain in the intestine. And besides changing your diet, which you will have to do with the weight sensor, you can use this as an additive system. This is also personalized for you, so you get these blister compartments. Each one of them contains a certain number and a certain combination of these medical products, which are based on your genetics. So it's going to have your name in here, and it will help you maintain the balance of the calories and reduce the total amount of calories that your body is absorbing while eating the same amount of food. Now this is a good idea during the weight loss phase when you want to lose weight rapidly. This is going to speed things up. And it's also a good way to later keep your weight. When you realize you've slightly increased your weight again, you can use this to reduce it again if your food change in food preferences is not enough to keep it easily. So this is a supplement that can only be ordered when we have the genetic information from the weight sensor, because it's personalized. Okay, these are the DNA Nutri Control programs. Down here we have a certain number of blood analyses. So this all is done with saliva. In saliva we have all of the genes of the body, and we can do all of these analyses. The blood analysis, here we can test certain antibodies. For example, the Ibd Sensor tests for IgE antibodies. An antibody is kind of like a recognizing tool for certain substances. They're usually meant to recognize bacteria that invade the body so that the immune system can fight them. And in allergies, these recognizing machines recognize something that isn't actually dangerous and interpret it as being dangerous. And that's what we can test. But in order to test these antibodies, we need a blood sample, which can be collected with the standard sets. So it's a finger prick. You collect a few drops of blood, you can send them in, and we can test for 112 different allergens. Then there's a footprint. This tests for IgG antibodies. It's kind of like the allergy test. However, it tests for slow reacting allergies. The allergy sensor is the stuff when you eat nuts, you immediately swell up. The footprint is a slow reaction. It can take several hours and days for you to feel bad. So it helps with detecting food intolerances, and you find out a whole list of 200 different types of food that you might want to avoid or you can eat without a problem if you have food intolerances. These are allergies. They are not caused by genes. It's not a genetic test. This is important to recognize. So the nutrition sensor will help you eat the right stuff to stay healthy. These tests will help you find out digestive problems that you have and help you solve them. So if you order them together, you will have to really combine the results yourself. The nutrition sensor will tell you based on your genes what sort of nutrients you need. And then we have a urine analysis, the Baby Sensor 100. This test is for newborn babies. However, you must not misunderstand this. It is ethically questionable if it's a good idea to test a baby for the risk of Alzheimer's disease or osteoporosis, all diseases that happen when they're 70, 80. In my opinion, it's not a good idea. It's not necessary. You can wait until this baby grows up to be 18 and choose him or herself if they want to know this information. So there are certain genetic tests that simply do not make sense. They're not urgent enough to do in babies. There are, however, a number of genetic diseases that can occur at an early age, and they usually happen between the age of 48 hours to 5 years. So these diseases happen before the child can decide for itself. And these diseases, in most cases, are completely preventable, if only you know. So it's change of nutrition, and then you can improve the child's health. You can, in many cases, avoid the development of slow development of the child, mental or physical retardation, or other physical or mental problems. And in many cases, this can be helped. It's kind of like the newborn screening program that every child goes through in many countries of Europe. In Germany and Austria, for example, there are 14 diseases that are being tested, because if you know soon enough, right after birth, you can do something about it. And this program basically extends this concept to 111 tests. This test will not do anything, tell you anything about osteoporosis or any diseases that happen later in life. This really just focuses on the sensible tests for newborn babies. So do not confuse this with Alzheimer's test for babies. So if a newborn needs a health test or a prevention test, this is the test to go for. We need a urine sample, which can also be collected with the sample set. And this here is the lifestyle kind of area. This is partly for nutritionists, also for doctors and for sports studios and so on. And the medical part, the DNA health control, has quite a few more different genetic tests, and I want to talk you through this. Let's first look at the individual tests. So, breast health sensor and prostate health sensor determines the risk of breast or prostate cancer, depending on if you're male or female. Gives you prevention advice, how to change your lifestyle to reduce the risk if you have a higher risk. It helps you detect it early if it ever is created or ever develops. And if it has developed, it helps you modify or optimize the medication for it. So many of these programs will have these three functions: prevention, if it happens, early detection, and if it already happened, better treatment. So it's not a program high risk, good luck. It's really a program, no matter at what stage you are, you don't have the disease or you already have it, it will always give you a benefit. It will always tell you about how to optimize treatment or prevent the disease, which obviously is the best thing to achieve. So this is really, it tells you the risk of the disease, helps you prevent it as good as is possible, and then also treat it better. Bone health sensors for osteoporosis. Again, it helps you prevent it and treat it better if you develop it. Toxo sensor is about detoxification. There are toxins like smoke, soot, and so on, smoke from cigarettes, that enter our body. And our body has certain genes that recognize these toxins and neutralize them so that they don't cause cancer, for example. And some people have genetic variations that break this function. So some people smoke, they have the detoxification, it's not a problem. Other people smoke the same amount, they don't have this protection, and they have a very high risk of developing lung cancer, for example. Same goes for heavy metals, free radicals, and other substances, alcoholism, and so on. So anything to do with toxification, changing the lifestyle to improve toxin load in the body is in the toxo sensor. The Pharmacol Sensor is kind of in that same area. It looks at medication detoxification. So if I take a drug, it is modified in the body and removed from the body, and that's the normal way. However, if my genes are broken that should do this process, the drug might not be removed from my body, and I take it 3 times a day, and it increases and causes severe side effects. So here we have more than 260 different drugs that can be modified in dose. Be careful with this drug, better to use another one or use only half the dose, or some people might even need to use twice the dose because they're breaking it down too fast. So this is an optimization of medication for 260 drugs. The Ibd sensor is age-related macular degeneration. That's an eye disease that's strongly genetically influenced. It basically causes a problem right where you look. So it first becomes gray, and then you completely lose sight. You can still see all around, but not where you focus your eye. And that is an eye disease that causes many cases of blindness. And there are certain environmental factors that you need to avoid if you get the disease. So it really helps you prevent it, if possible, change your lifestyle to have the best chances of preventing it, and then also to detect it early. So there's some self-tests that you can do in regular intervals to get treatment if it ever happens. Glaucoma is also an eye disease. It's pretty much the opposite of macular degeneration. In this case, the field of sight decreases from the outside. And it's quite easy to treat with eye drops, but usually by the time that you get the first symptoms, 95% of the cells are already irreparably damaged. So this really helps you in early detection. You find out you have an extremely high risk. You find out how often you should go to an eye doctor, what sort of tests should be done, and then it motivates you to go there regularly, and whenever it develops, you can treat it and save your eyesight. Then the Thrombo sensor is all about thrombosis. Certain genes prevent thrombosis in your body. Thrombosis is a blood clot that blocks blood supply to other areas of the body and can cause a stroke, heart attack, and so on. And this is the genetic risk as well as the treatment and medication that you can use to treat an increased risk. It's also interesting for women who want to use hormone replacement therapy, because if they have a high thrombosis risk genetically, this is a very bad idea, it's very dangerous. Also for hormonal preparations for contraception. So young women should be tested before they get hormonal substances, because in combination with thrombosis, this can be a very high risk of disease. Then general cardiovascular disease, that's cholesterol, homocysteine, HDL, LDL cholesterol, sudden cardiac death. It's all about the risks, what medication works for you, what prevention you should do, and if it develops, really how you can treat it best. Diabetes sensor is the same concept. How high is your risk of diabetes? What kind of preventive measures are effective for you? What should you follow based on your genetic risk? And then also, if you develop it, what drugs are more effective and how can you optimize your medication therapy? And hypertension sensor is all about blood pressure. You can obviously measure it with a normal blood pressure measurement, so it really doesn't help you much in detecting it early, but it helps you with choosing the right drugs if you need to be medicated for it, because some drugs are just more effective, others are not, and it helps you optimize your therapy. Gluten sensor is all about celiac disease or gluten intolerance. Gluten is a protein in wheat, and it causes a very strong effect in people that are gluten intolerant. And it helps you find out, do you have the genetic predisposition? And if you develop it, it helps you to choose food that does not cause a problem in your digestion. Lactose sensor is the genetic variation that causes lactose intolerance, one of the most common food intolerances that we have. 20% of the population are affected by it, and here we can test the gene, we can find out your likelihood of developing the disease, we can help you diagnose it right in time. Usually it takes 5 years for correct diagnosis. The Ibd sensor is for Crohn's disease or inflammatory bowel disease. It's basically a disease where your intestine gets inflamed, and genetic variations increase the likelihood and help you diagnose it correctly. And it will also help you how to change your diet to combat the symptoms best. It will not help you to completely treat it if you have the disease, but it will help you manage the symptoms and improve the medication therapy if you are on medication therapy, or just finding out what dosage and what drugs are useful for it. Alzheimer's sensor is for Alzheimer's disease, dementia, age dementia. It is a disease that is currently still untreatable. However, there are a number of environmental factors and prevention factors that can reduce the likelihood that you get it and can delay the onset. So here we find out the likelihood of developing the disease. You can find out how do you have to change your nutrition, how do you exercise your brain, your mind to keep mentally fit, and what sort of preventive measures you could do. Coffee drinking, for example, is surprisingly very beneficial to avoid or reduce the risk of Alzheimer's disease. So really it's a determination of the risk, lifestyle change to reduce the risk of developing the disease, and if you develop it, it helps you choose the right medication. So again, it's a whole program for every stage of the disease. The joint sensor is about rheumatoid arthritis. Basically, genes modify the aggressiveness of the immune system, and the immune system can attack the cartilage in the finger joints and all joints. And by having a genetic test, you find out the risk. You can change your diet and nutrition. We help you in changing your nutrition to avoid substances that speed up the process. And also, again, medication, if you really need to be medicated for this disease, can be modified, can be improved. You choose the right drugs, the ones that work, and avoid the ones that don't, and avoid side effects. The Periodontitis Sensor also finds out the aggressiveness of the immune system, for one, because in your mouth there are bacteria which continuously invade the gums, and the immune system continuously comes and munches them up. So there is a constant invasion and constant fighting back, and this works normally in most people. However, some people have a too strong immune system. So when the bacteria enter the gums, the immune system reacts with all force, and this inflammation causes, it's actually the immune system that causes the problem, causes the bone to weaken. Eventually the teeth can fall out. And another factor is if you have a titanium implant, it's like a screw that can be screwed into the bone to attach a tooth. Some people, due to genetic variations, have a very high risk of losing this implant because the immune system reacts. And we can estimate the risk of the disease, give preventive advice to reduce the risk, more oral hygiene. Also, dentists should be visited more often. They can do certain things to reduce the risk. And also, when you need an implant, you can choose the right material so that you don't lose the implant within a few weeks due to a bad reaction. Then the Hiv Resistance Sensor. There's an interesting effect. There are some people who appear to be HIV resistant, the virus, HIV/AIDS. And that is because they have a certain variation where the virus cannot enter the cells. Some people are completely resistant. Other people have a slower progression because they have one normal and one mutated gene. And for one thing, if you're HIV infected, you can do this test to find out how fast the progression is likely to be due to this gene. But more importantly, if HIV is treated correctly, you almost have a normal lifespan. So effective medical treatment is very, very important for HIV patients. So what we found out here is first the resistance status, but more importantly, which drugs work, which ones don't, which ones cause side effects, and what dosages should be used. So this is a very important factor in the HIV resistance sensor. And then the iron sensor, that detects how much iron you absorb from your food. Some people have a genetic variation that absorbs too much iron, which causes the disease hemochromatosis. And some people, when you have this, it's a very nice example of preventive genetics. When you have this genetic variation, you can do prevention, and that is to go to blood donations 4 to 6 times per year. Blood contains a lot of iron. You lose a lot of blood through this blood donation. Your body builds up new blood, and that lowers the iron content in your body. And by doing this in regular intervals, you can stay healthy. So really, it's blood donations to stay healthy. It's not general guidelines like eat healthy and do exercise, which everybody knows. So some of these preventive measures are very, very specific. And this is the iron sensor. Now here you see these kinds of boxes, and these are just different packages. For example, the gastrointestinal sensor, you can see this box here. It includes all of these 3 products here. So it's a lactose, gluten, and Ibd sensor. It's all about digestion, digestive problems, and so on. So if a person has digestive problems, you don't know what it is, this might be a good test for the genetic side. From the food side, the footprint or the allergy sensor might also be an approach. So if it's the genes, we find it out here, and if it's the fast-acting allergies or slow-acting allergies, this can be found out here. Then the primary prevention sensor contains thrombosis, cardiovascular disease, high blood pressure, and diabetes. So these 4 would be included in the primary prevention sensor. The FEM sensor 40+, or the Andros sensor 40+, contains breast or prostate cancer, bone health, osteoporosis, detoxification, thrombosis, and cardiovascular disease. Then the premium sensor contains all of these in here. And here you also see the nutrition sensor. This is exactly the same thing that I've told you before. So this here is the same as this. And then we have the Premium Plus, which also contains the diseases down here, and also the weight sensor. So this whole program is included in the Premium Plus. Just some information. Here, the weight sensor is the most popular, and in the medical side, it's usually the Premium Plus that is most popular. So it's always the whole panel that the patients are interested in rather than individual tests. And then we've got these three down here, which don't really make sense to put into a panel because they're very specific. The Adhd sensor is hyperactivity disorder. It helps you identify the risk of developing the disease. It's for children in this case that are hyperactive or inattentive. There are two different kinds, hyperactive or inattentive type. It tells you which type it is likely, and it also helps you choose the right medication and the right dose in case the child needs to be medicated. Then there's the Fem sensor pregnancy, which contains the most important tests for pregnancy, including thrombosis, which causes 1/3 of all deaths during pregnancy. So how to combat this, how to make sure that mother and child are safe from thrombosis in this case. And the female health sensor is kind of like the Fem sensor 40+, but it has been produced by the well-known gynecologist, Dr. Huber. He's an Austrian gynecologist, and he created this panel based on his deep understanding of hormones and all of the health aspects of women. So this is the concept of lifestyle genetics, athletic performance genetics, some of the blood analyses that we have, and the medical genetics. And it's really important that the medical genetics, this is all about diseases. These should be done with a doctor, in combination with a doctor, or the person should really visit the doctor with the result to make sure that the guidance through the program is done correctly. So in Austria, Germany, and Switzerland, the law even doesn't allow to do medical genetics without a doctor being involved, which is a sensible idea. And the lifestyle genetics also, they make sense only with experts in the field. So nutritionists using nutrient genetics, and sports studios using weight management testing and so on. So this is an overview of the portfolio of the different tests, and there will be a training session for each one of these products, and you can look at them separately. This was just an overview of what sort of genetic tests would be suitable for what sort of patient or person. And that's the end of chapter 19, an overview of the analyses.